All right, so as Dr. Miller said, my name is Jessica Dabis. I'm a physical therapist here, and I specialize in artistic athletes, gymnasts, and dancers. And I honestly, there's nobody I love working more with than gymnasts. It's like I said, it's such a unique sport. There's such a level of dedication, unique physical demands. But on that same note, it's a sport that requires more than just showing up and putting your training time in at the gym. And so today, what I want to talk about is the physical recovery and the mental recovery that's going to not only keep you healthy, but get you closer to your performance goals. And my goal today is to either give you a review or a fresh perspective on how important it is to develop physical recovery habits, as well as mental strength skills. And then really, ultimately, I want you to be able to walk away with a few action items and some tools that you can implement immediately, because I know this is the most stressful time of the season for a lot of you. This is that championship time where your biggest meet might be just around the corner. And even if that's not the case, this is something that you can start really working on improving these skills in the off season to set you up for a great season coming up here in this next year. So what I want to start by talking about the idea of resilience, because to me, what this really boils down to is resilience. Now, the definition of resilience is the ability of a substance to recoil, resume its original shape after bending, stretching, or compressing, and to really successfully adapt to the stresses that it faces without deforming or kind of in our case, we would look at this as getting injured or succumbing to overuse side effects of training. And so as an athlete, we think of this as refueling your tank, both the mental and physical resources that you need to allow your tissue and mindset to grow from your training challenges rather than getting overloaded. Now, you can call this a problem of under recovery, or you can think of it as overtraining. But either way, it really is the same idea where if we don't match training load demands to recovery, then instead of adapting to your training and making gains, you're going to tip into a deficit and our bodies will become depleted. So signs of under recovery range from impaired performance, hormonal or cycle changes, vulnerability to injury, dampened immune response, or lack of gains from training. And so today what I want to talk about is how we can stay in that balance and refill the tank so we avoid being in a state of under recovery. I want to talk about first recovery strategies that focus on the physical. And this is going to be based on kind of what we know are our best evidence. I'll give you specific dosage recommendations. And then I want to take a step back and look at the bigger picture at global health, including mental wellness, mental skills, and performance anxiety management tools that you can use for your meet day. And then finally, we're going to go over a few specific tools that I will have available to you via email, including wellness tracking. Okay. All right. So starting with the physical, let me go ahead. So starting with the physical, I want to talk about tissue recovery methods that have some evidence behind them. With soft tissue health, the main reasons that we're going to want to use these recovery tools around training are we want to help clear out inflammatory byproducts from training. We want to enhance blood flow and nutrient delivery to process that tissue repair and lead to muscle gains. And then we want to recreate a reduction in muscle soreness. And this is important because soreness often creates short-term muscle stiffness. And so, as a gymnast, you know this. When you're really sore, you also feel like you're tighter than usual. And then that soreness can also be a barrier to full muscle strength capacity at your next practice. And so if we divide these tools by timing, you want to implement soft tissue mobility such as foam rolling or vibration or percussive therapy, as well as heat before training. These are going to aim to increase the blood flow to the area and relax muscle tension, both of which are going to improve your tissue mobility so that you can then use that improved range of motion when you load your joints right afterwards in practice. And this is going to be in contrast to cold therapy, which I talk about later, where you don't necessarily get those tissue mobility benefits immediately. So these top three are what we're thinking about when we think before training, and that's going to be pretty immediately before. And then when it comes to post-training recovery, on the other hand, the best tools that we want to use are, again, foam rolling and vibration therapies will come in handy, but this is where cold immersion therapy and compression therapy really come in because they act to accelerate clearing out the byproducts from that tissue damage that contributes to soreness. And so for compression, this is something you could use dynamically. Some of you may be familiar with Game Ready or Normatec. Out those like the big leg boots that you wear after. That's something you're going to want to use within 60 minutes after practice. So pretty shortly after. And the research shows that 15 or 20 minutes in Normatec boots or those similar products out there shows a reduction in soreness over the next couple of days. Now, with static compression garments, these are helpful, again, to decrease soreness if you wear them over the next 24 to 48 hours. But it's worth mentioning that the greatest benefits occur if you use 20 to 30 millimeters Hg medical grade compression rather than just, non-specific over-the-counter lighter or light to moderate compression sleeves. And so those are helpful to use, again, kind of depending on which of those you prefer. Another way to help clear out soreness is going to be cold therapy. And I know this is something that is very popular among a lot of the gymnasts that I talk to. Sometimes you can do total body plunge. You can also do partial cold plunge. So especially for those lower extremity soreness issues. And then there's also air cryotherapy. And all of these are going to accelerate getting that inflammation out of the area. You can also do contrast bath, which is going to be alternating between cold and heat. And so I'll talk about a little bit more about these in the dosage here in a couple of minutes. The last one that I want to mention before I go into a little bit more detail is hyperbaric oxygen therapy. And so this is one that has less robust evidence, but I do get questions about it sometimes. So the idea with hyperbaric oxygen therapy, or HbO2, is that it's been shown to accelerate the resolution of that inflammatory process and muscle fiber regeneration. Similar to the other tools that are on the slide, the idea is that it improves those processes to a much more significant degree. And so with the evidence that's out there, some studies show a benefit, some studies show not quite as much, but what we know is that the benefits seem to be more pronounced in ligaments, tendons, or musculotendinous junction tissues rather than in muscle bellies. So thinking this could be useful for improving Achilles soreness or quad tendon soreness or MCL knee sprains, rather than soreness kind of in the middle of your thigh, that quad muscle belly. And so the studies that show benefits indicate that if you want to use this, you want to do it within a few hours of that training or whatever it was that caused that tissue soreness. And then you would want to perform multiple sessions over a period of 5 to 10 days. So for that reason as well, this is something that's more cost prohibitive. And that in combination with the conflicting evidence it's hard to recommend it strongly, but again, it's something that's out there, and I think over the next couple of years, we'll continue to hear more about it. Now, let's move back to some of the more common forms of soft tissue recovery, and this is going to be about mobility and soreness. So talking about soft tissue mobility recovery, you can use this both before training and after training. Foam rolling is very common. I know, I do it here with patients, and many of you already accustomed to foam rolling before practice. This is something that's acting to prep the tissue for training demands, as well as temporarily like warm up the tissues, prep the nervous system, and give you short-term flexibility improvements, which again means that over the next hour or so, you have access to that increased flexibility. And you can also build strength in those end ranges if you can, stretch and foam roll before and get a little bit further, such as in your front splits, translating to your leaps. So this is really important for injury prevention on the kind of from the medical end, because if you're loading a joint with full mobility, then the load will be properly distributed across the joint, versus if you have tightness, then your body's going to have to compensate to unevenly distribute the load, such as tight shoulders, meaning that your body has to load the load back more in things where you need to have that full overhead mobility. So that's just one example where, we don't want to have that extra stress on the back. So foam rolling could help to create safer movement patterns if you're able to do it right before practice. And on the other hand, after training, foam rolling and vibration therapy as well are going to both act to clear out those byproducts that contribute to soreness. So these have been shown to reduce perceived fatigue and soreness after training, and get you back to feeling like you're at your full tank for the next day. And so some of you may be pretty familiar with percussive and vibration therapy. I want to talk about that a little bit. This is going to be your vibrating foam rollers, your whole body vibration platforms that you stand on, and then percussive fascial guns like Theragun. I think I see those sometimes at the gym. And this is something where, like foam rollers, you can do it before or you can do it after. The idea behind using something like your Theragun or your vibration foam roller before is that you're using short duration and low frequency stimulation to the muscles. So about 30 seconds or less per muscle group, and temporarily increase muscle strength output and maximum power over the next couple hours based on stimulating the muscle fibers. So that's going to be before. It's going to be shorter, 30 seconds or less. Then after training, again, we're looking at shuttling that soreness out sooner. And this is going to focus on longer duration, 2 minutes or more of that direct contact with the muscle groups. Or if you're using a whole body vibration platform, you would use it for about 10 to 15 minutes after training in various stretching positions or holds. And that has been shown to be more effective than static stretching alone. So both of these are options if you have them available. They're possibly more effective than static holds and more effective than just foam rolling alone. But again, it depends on what you have access to. And I've listed the specific parameters here. 20 to 50 hertz is what's recommended for both of the durations that I listed. And you can usually find that information in the details if you're looking at buying a specific product. Right. And so the other and most popular researched recovery tool that I want to talk about is, of course, cold therapy. So cold and contrast water immersion therapy, as well as cryo air, are all used to decrease tissue inflammation. And again, the goal is almost always to decrease the amount of soreness and the duration that you have that soreness. The goal being to get back to full muscle strength capacity by the next practice. Cryotherapy air has also been linked to greater ease of falling asleep at night and possibly greater quality of sleep that night. So that is one interesting aspect, and that's something that you can, see if you get that benefit as well when you use that. For cryo air, that would be a shorter 2 to 4 minute dosage versus if you're doing cold plunge, you're looking at 10 to 15 minutes. And those would always be after practice because your muscles do get a little bit of a temporary tightening or loss of flexibility when they're exposed to that cold air. So we're really just focusing on recovery with that. Now, contrast immersion is something that could be more appropriate to use not only after, but also if you are wanting to maintain flexibility or minimize any loss of flexibility, because adding that heat in can possibly accelerate getting the nutrients back into the tissues, and then also may help you keep tissue extensibility right after you go through your contrast protocol. The most common protocol here is going to be about a 1-to-1 ratio, so that could be either 1 minute, or 2 minutes, 2 minutes. You can also do a 2-to-1 ratio where you're in the cold for a little bit longer. This is something that you'll do for about 10 to 20 minutes after practice, after your training. And so I've created a visual here which shows the different recovery tool options and where they fit into your training schedule. So some of these are going to overlap, but the idea is that, you want to prep the tissue before, and then anything after, you're always trying to get that soreness out of the way. And then for after meets, you might do something more intense like cryo, air, or cold plunge, where we know that you might feel a little tighter or not be able to exert as much power right after, but it might have a more pronounced effect on shuttling out that soreness. So with that being said, let's move to more global recovery versus just that local soft tissue recovery. We're going to start with sleep. Sleep is incredibly important for performance, and ideally athletes are getting more sleep than the average adolescent, because this is where your brain and tissue repair occurs. So it's also important for regulation of the emotional brain, and it's vital for the immune system. I want to think of it like all the gains that you're making in training. Sleep is when the actual process of that body's tissue regeneration is incorporated. And so it's important to create those muscular strength gains and adaptations, with those adaptations also meaning that the same amount of work is going to lead to less soreness. So, right. And so beyond the physical there, I want to talk about mental skills now. And we've got Dr. Stapleton here, our sports psychologist, on the line, and she'll be available for any questions y'all have on anything I talk about today or otherwise in terms of mental skills after the presentation. But really, mental skills are important in every sport, but especially in a sport like gymnastics, which is, so both demanding on the body, but also there's a culture of true dedication in gymnastics that can sometimes lead to feelings of pressure or feelings of being behind, or maybe not knowing how to navigate when success doesn't always come the way it used to. And so really what I want to talk about here as the base of your mental skills is the idea of having a growth mindset. So some of you might be familiar with this, but a growth mindset is about seeing stressors as opportunities to improve yourself and having the ability to evaluate your own thinking, especially if we're getting into negative thought patterns, and redirect that. So we want to think about a challenge as an opportunity to get better rather than a reflection of your own deficits or a reflection of any sense of failure. Growth mindset is based on this idea of self-efficacy, and it's important to differentiate confidence, which can sometimes sound similar, from the idea of self-efficacy. So confidence is focused on results, meaning your past successes or how you did at the last meet, which you can't necessarily directly control, versus self-efficacy, which is focused on the process. So the idea is that self-efficacy is focused on what you can control, such as your discipline, your belief in your ability to carry out a process and do what it takes to work towards a goal. And a higher self-efficacy means that we're going to put more effort and consistency into your day-to-day processes. You're going to persist when you face obstacles. And then again, seeing failure as that learning opportunity that is caused by modifiable factors rather than seeing it as something that means that you're not good enough. And so we want to make sure that your confidence is ultimately based on self-efficacy, always focusing on that theme of like what I can control, right? Like what's right in front of me, what can I control? Let me put my energy into that. So people's belief in their efficacy is developed by 4 primary sources of influence, which is listed here. And so I just want to quickly go over these. Mastery experiences is based on how you perceive your past successes. So this does look a lot like confidence. And then you've also got vicarious experiences. So this is seeing someone that you feel like is similar to you, a teammate your age who might have similar strengths or levels of skill as you. If you see them succeed or achieve something, it's going to feel more attainable to you. You could also use mental imagery to get the same effect. Verbal persuasion means that you can grow in your belief in yourself through encouragement from your teammates, your parents, getting helpful coaching cues after you make errors. And then finally, the idea of your interpretation of your emotional states means that you're able to see your nerves as less threatening and practice relaxation strategies to feel like you can control how you react when you get into a high pressure situation. Right. And so goal setting is another very important tool to build self-efficacy, because it's going to give you the structure to see that end goal and then lay out the steps or process goals that will help you achieve kind of where you ultimately want to end up. And the outcome goal is that ultimate prize at the top of the mountain. This is going to be like your college gymnastic goals, or if you have elite gymnastic goals, where the process goals are the habits that you build that are fully in your control and take you each step closer towards that final outcome goal. And so here are some examples. Again, we think about that ultimate outcome goal as where you see the top of your gymnastics career. Is it the Olympics? Is it a college scholarship? Is it a certain meet? Whatever that be, from there, you're going to have yearly performance goals, right? So what do you want to achieve for this season? And then both of those, more directly your annual goals, are worked towards by creating specific and measurable process goals. So process goal is going to be something like, all right, I'm going to sit in my splits for 2 minutes every day at home, or visualizing myself doing my routines perfectly every night before I go to sleep. That's something that no matter what score you get at the meet, you're in full control over the process goals and doing those with a disciplined manner. All right. And so we've got our goals, and that's really important for creating structure and giving yourself a direction in terms of feeling like you've got that self-efficacy to achieve it. But of course, inevitably, I think we've all felt this before, that pressure before a meet. And no matter how prepared you are, everyone gets some sort of performance anxiety or nervousness um, before something that you feel like is really important, whether it be a championship meet or the first meet of the season. And so this can be, that pressure to meet your goals, or just the unpredictability of competition, if you're feeling under the weather, or the fear of falling short. And if you can't control it, then it can get in the way of your execution. And that's why building your mental strength skills is just as important as setting goals, right? Because you can set your goals and do great with those, but you want to build your own personal performance anxiety toolbox to help deal with those nerves on the day of or leading up to the competition. And the idea behind these strategies is that anxiety often comes from getting overwhelmed by negative thoughts that are racing in your mind. And so we want to override that by getting out of the mind sometimes and getting into the body to stay present. So here are, I've listed a few strategies here, and my hope is that at least one or some of these strategies you can connect with and even start practicing starting tomorrow. Really something that you can practice every day and see which ones you really connect with. Controlled breathing techniques are great. This is again, like an easy to apply technique for regulating your heart rate, right? When you get to the meet and you start feeling that nervousness, or you start feeling those physical symptoms, like your chest gets tight, or you feel that tension in your shoulders, you want to have a few breathing techniques like deep diaphragmatic breathing or box breathing to help calm you down. And I have Dr. Stapleton gave me this great graphic of box breathing here on the slide. And this is going to be based on a 4-second breath count. So you're going to inhale through your nose for a count of 4. Then you hold at the top for 4 seconds. And then you're going to exhale for a 4-second count. I like to do a pursed lip exhale, and sometimes add like a belly exhale with my patients. And then you hold for another 4 seconds at the bottom. And again, this is one of many, but it's something that you can start practicing in practice. And then when you find one that really helps calm you down, that's going to be part of your toolbox once you get to meet day. Another effective method in terms of the more mental side of nerves is mental reframing. So this is where you identify catastrophic thoughts or worst case scenarios like, oh man, if I fail, if I mess up at this meet, like my season is over, or like my gymnastics career is over. And you want to make it a practice to challenge those negative assumptions and that worst case thinking. So that looks like asking, how likely is it that my worst fear is actually going to happen? Most often, that your fears are exaggerated. And so if you can start to give yourself perspective, that can help calm you down. Another strategy is to consider something that, like, even worse than your fear, to again give you that perspective, or to say, hey, if this happens, so what? Like, it won't actually be that bad. And then, thinking about what are the odds that it actually will happen. And that's something called doing probability checks. So there's many different kind of specific mental reframing techniques out there, but it's really about giving yourself perspective in the mind, in addition to those more body-centered techniques like breathing. And then I also have progressive muscle relaxation up here. That's something where you're going to squeeze and tighten a muscle group as hard as you can for a few seconds, like shrugging your shoulders as hard as you can. And then you're going to fully relax that muscle group. And it's something where you can go up or down the body kind of one muscle group at a time to really get you out of that overthinking. And then another tool that I think is so important is establishing a pre-competition routine. And this is going to include visualization and grounding techniques, really using all five senses, right? Like feeling the bar, smelling the chalk. You want to help create a sense of control and familiarity to make it easier to perform under pressure. So again, this is something you want to start practicing in low stakes situations if you don't already have a mental imagery routine. And then once you get to the meet, it feels really familiar. And so by incorporating these strategies, we want to turn that nervous energy into a tool for performance. But it's also a great set of strategies that you can apply to mental blocks, which is not uncommon when you're coming back from injury or when you're learning new skills or struggling with a skill. And of course, this is a big topic. We could, say much more about it. But I did just want to touch on it briefly because I know it's something, it's real, and it's something that a lot of gymnasts are aware of and have dealt with at some point. But the mental blocks are related to getting overwhelmed by negative emotions that are related to anxiety over skill or hesitation from past errors, or a loss of physical connection with your cues during the skill that all of a sudden makes you feel like you can't perform something that you used to be able to perform. And that can spiral into a feeling of getting further from where you want to be in terms of that skill. So this is where you want to use the skills that I just talked about in the last slide of getting out of your brain and into your body, breathing drills or muscle relaxation. You want to use imagery to practice that skill in your mind. And then you want to be flexible with yourself. You need to be okay with taking a step back on some days by going back to foundational drills, changing the surface, asking for a spot to help make the skill feel more approachable that day, or take out the twist. So your needs can change from day to day, but this is something called graded exposure. And finding a way to make something more approachable through modifications helps to take away that overwhelm over time. And again, there's not one strategy that works for everybody. So you play around with things and seek support from your teammates, your support system, and just start to figure out what makes up your personal toolbox. And then here is this is a slide. If you like, you can take a screenshot, but it's a graphic that just touches on a few of the mental block navigation skills that I just talked about. Okay. All right, so I feel like I talked about maybe a little or a lot, depending on how many of these tools you are already familiar with, but it can seem like a lot to think about. So this is where using a simple wellness tracking chart, either on paper or a phone app, or maybe a combination of a couple of apps, is, I feel, a great way to keep the recovery and the prep tools that I talked about on your mental radar every day. You want to build a habit of daily check-ins so you can get to know yourself, your body, your mind better, and also start to notice patterns sooner. So I definitely would include, assessing your sleep, soreness level, and mood or motivation pretty regularly, again, to pick up on, trends or patterns and see if there's something you need to change, rather than not really understanding like why you've been feeling sluggish for X amount of time. And then on that note, I have put together a couple of sheets, including a the foam rolling sheet, and there's a wellness tracking chart, and then a recovery tools tracker that creates some structure for incorporating specific recovery tools into your routine if you don't already. So it's a cool little point system that makes sure you're thinking about all the different recovery tools that you have at your disposal. And I have my email here in red. So please reach out to me if you're interested, and I will go ahead and email these to you. Overall, I think they'd be helpful. I hope that something I talked about today was new to you or gave you perspective on something that you maybe knew a little bit about or wanted to learn more about. And my goal is for these things ultimately to hopefully keep you injury free. So like Dr. Miller said, so we don't have to see you, but I'm always thrilled when you guys walk through the door. So thank you all for listening. I'll go ahead and hand it back over to Monique for the Q&A.
Thank you, Jessica. This was a great presentation, and I know all the families and athletes will really benefit from all the advice that you have to give. So I appreciate that. Everyone, this will be recorded, so we will send this out in a follow-up email for you guys. Any handouts Jessica has, this recording, and we'll also share some previous recordings from other events that we've done in the past. We have a great one on nutrition. If anybody has any questions, feel free to submit them in the Q&A. I know many of you submitted them in advance, so I have a few that I'd love to ask Dr. Miller, Dr. Stapleton, and Jessica as well. So my first question that was submitted by someone is for you, Dr. Miller. And so the question someone had was, my daughter has been working out almost every day and she's only 7 years old. Will this hurt or hinder any physical growth now or in the future?
We think exercise is wonderful. We want kids to be active every day. We want them doing at least 60 minutes of exercise every day. And so it is good to be physically active on a daily basis at the age of 7. But just like most things in life, it's a balance. Too much of anything can be a problem down the road. And so I think some of the keys are who's driving it, and I don't mean as the parents driving our kids there to and from. We all do a lot of that, but who's pushing that? And is the 7-year-old enjoying it? I've got an 8-year-old who's playing hockey, and he would play every day more and more if I would let him. And so as long as she's enjoying it, I think that's an important aspect of it. We look at how much they're doing. Sort of a general rule of thumb is if somebody is training more hours per week than their age, then we do see the risk of overuse injuries go up. So, a 7-year-old doing 7 hours or less a week is probably a reasonable level. Obviously, in gymnastics, we know that that number often gets exceeded, but we do see a lot of overuse injuries with that. And so, overall, it's safe to be active on a daily basis. We do want to make sure that there is some time. We do like them to have, a day of rest a week from their specific sport. That doesn't mean they have to sit on the sofa, but maybe a rest from gymnastics or whatever their specific sport is each week. And we like to have them have some built-in recovery periods, like all the things that Jessica was talking about. The body does need time to recover.
Exactly. I completely agree with you, Dr. Miller. Dr. Stapleton, someone submitted a great question for you. Any tips that you would have on how to prepare to resume activities after an injury, especially if you're quite frustrated with your progressions back into the gym?
Sure. I think it's really important first to just normalize that we wouldn't expect an athlete to come back at the same exact level of performance that they were prior to their injury. I think there's often a lot of pressure to get back and jump back and be right where you were when you left off, and provide that space and support to feel frustrated. We really want to validate for them. However, I would try and have the athlete reflect on how they achieved their goals in the past, maybe progress they made in the past, and then generate some small daily and weekly process goals, as Jessica mentioned, kind of based on effort rather than results, to help them make forward progress and feel a sense of accomplishment on a regular basis that really will help them feel like they're making, forward momentum and reaching their goals again. Skills may not come back immediately, but, with time and consistency, they'll get there. And most importantly, I think emphasizing that comparing oneself to others will only lead to distress and often only negatively impacts performance, which is kind of the opposite of what they're aiming for there. So constant reframes and reminders to focus on their recovery and their journey over everyone else is really key. If there are factors of fear of re-injury, then I'd also recommend kind of using that graded exposure that Jessica mentioned, breaking down the skills into its smallest components, only moving on to the next component or level of difficulty once they can compete that previous component without significant distress or hesitation, and then using relaxation skills prior to implementation of those skills. So breathing exercises, mental reframing, self-talk, mental rehearsal, imagery are all really important to help, get them back to their previous level.
Awesome. Thank you, Dr. Stapleton. The next question I have is for Dr. Miller and Jada and Jessica. This is kind of like a combo. We get asked about gymnastics wrist a lot. So Dr. Miller, what is the normal healing time with gymnastics wrist for high-level gymnasts? And Jessica, what's kind of an appropriate progression back into the gym?
So yeah, thanks, Monique. Gymnast wrist is a common term for a common injury that we see in athletes that do a lot of upper body activity that loads their wrists. And so it's essentially a stress fracture of the growth plates in the radius bone. So a lot of times they will have pain kind of over the back or the side of their wrist. And when we see mostly our gymnasts, but also sometimes cheer, do a lot of tumbling. And the recovery time depends frequently on the severity of the injury. Unfortunately, a lot of times, gymnasts have been trained to push through discomfort and continue to push themselves. And so by the time that they present to us with gymnast wrist as an example of an injury, oftentimes it's further progressed. They've essentially dug themselves into a deeper hole, and therefore there's more damage. It's going to take longer for the body to heal and to repair it, hence a longer time away to allow them to recover. And so if we can pick up on these a little bit earlier and respond to injuries before they get as bad, oftentimes they can get better much quicker and not miss as much time and overall get them back faster.
Yeah, and I will add to that, as Dr. Miller was saying that, it reminded me, it's hard to mention everything, of course, in one presentation, but in terms of when we talk about mental skills and knowing your body and kind of understanding your body and your mind better, part of that is also the challenge of advocating for yourself. And I know that that's something that it's a challenge for gymnasts. They're all very good at being disciplined and doing kind of what it takes, quote unquote. But like Dr. Miller said, ideally, if gymnasts can feel empowered to kind of recognize when it's more than just normal soreness, and let their parents, coach, provider know sooner, then that's always better for everyone, because Dr. Miller doesn't have to tell them what they don't want to hear, and I can get them back sooner. But the idea is, they'll see the provider and with that diagnosis and whatever imaging or restrictions they have, we'll work on their limitations in therapy. I definitely want them to get back to having full wrist extension, range of motion, even once they're pain-free, before we want to build back up to those weight-bearing skills. Because if they don't have full range of motion, then they're going to go back to putting more stress, a disproportionate amount of stress on that growth plate. So that's a big component of getting full range of motion and then building back up that grip strength to feed into that return to gymnastics progression. And then we want to make sure, again, with graded exposure, that they don't go back to everything all at once. They go back starting with softer surface and they build their reps back up so that we don't do too much at once and overload the joint. Again.
Thank you guys so much. I know that's a very common question we get asked. And then our last question tonight is for you, Dr. Stapleton. And this is more of how can the parents help their athlete when they're dealing with quite a few mental blocks? So maybe it just frustration of the sport, frustration of their progression of injuries, but what would you give some advice to the parents?
I think being supportive and having an open kind of non-judgmental conversation with them about what may be contributing to the challenges they're having is really important, because often there are coaching or teammate or other things going on outside of sport that can contribute. Really important, I think, to take the pressure off of the need to perform. I think having conversations around, passion for the sport, are you having fun, are really important, and explicitly asking that question. I hear so many times from athletes who are having mental blocks of like, this feels like a job. I don't love the sport anymore. And that is something that we really need to kind of get to the bottom of so we can then help them work through these things. I think otherwise breaking down the skill, helping them break it down, because sometimes it feels so overwhelming that they don't know where to start. So they can kind of confidently build it back up. Talking to the coaches is another thing. Talk to the coaches to see if you can work together to create a supportive plan for training to make them feel supported in getting back and assisting. And I think if needed, helping find additional mental health intervention if that's warranted, if there are other emotional kind of factors contributing to what's going on in the gym.
Awesome. Well, thank you, all of my amazing presenters. You guys are so valuable to the gymnastics population. I know you guys see a lot of them. So I appreciate you guys taking your time and effort to kind of educate this group. And as a follow-up to everybody, I will send all of these slides, this video, this recorded session, so you guys can have it for future dates. So thank you, everybody.